people need you sort of in a crisis situation. It's often like your relationship with a plumber. You don't need a plumber 3 weeks from now. You don't need a plumber you need a plumber 30 seconds ago or 30 minutes ago. In a lot of cases in the home care world, mom's fallen, dad's fallen, grandma, grandpa, whatever, you've fallen. You're in the hospital for a couple of days. They want to discharge you. You don't want to go to rehab, or you want to go to rehab, but you want to go with somebody to hold your hand. I need help. Where do I go? Right. And that's the service that we provide.
Welcome to Mic Up, the next chapter, moving past disconnected systems, the podcast where we explore how innovation, care, and smarter systems can transform lives and industries. I'm your host, Kristin Guglielmo. Today, we are focusing on a topic that impacts so many families, home care. Specifically, we'll be highlighting Synergy HomeCare and a leading provider of non-medical home care services, from personal assistance to memory care and companionship. They're helping families across the country support their loved ones with dignity and compassion. I'm thrilled to be joined by Casey Holstein from Synergy HomeCare, who will share more about the mission, service, and the heart behind the work they do. Casey, thank you for being here.
Kristin, thank you very much for inviting me.
So could you start by telling us a little bit about yourself? What led you into the field of home care?
As Kristin mentioned, my name is Casey Holstein. I am the co-owner of Synergy HomeCare Metro, New Jersey. We're a non-medical home care agency servicing 5 counties in northern New Jersey. I'm 64 years old, and I started this business about 17 and a half years ago with my partner, David Katz. And what led us to this point was, as many entrepreneurs in this business get into, is a personal story. So my story is that my wife, at the time, developed breast cancer, had a 5-year battle, and passed away. Started in 2002, and she passed away in 2007. I became a single dad with 2 young girls, ages 8 and 6. Had been in a previous career commuting into New York City, and needed to change my lifestyle because I wanted to be a very engaged parent. It's how I was raised and how I wanted to raise my kids. I was searching for opportunities, and I was introduced to David from a business standpoint. I had known him as an acquaintance in the same town that we lived in, and he was looking for something to do with an entrepreneurial spirit as well. And he had been affected in the home care world by caring for his father-in-law for years. So we got together. We talked on many occasions about what we were looking for in this chapter of our lives, and we decided to go into business together. And it's been a very successful partnership for the last 17 years. So,
and that's amazing. And and care for your elders, or even if you need it for your children. And it's so difficult to find that, and to find a place that you trust. So that certainly amazing story about how it inspired you to.
So when we started it, we sat down and we did our mission statement type of thinking and outline of what we wanted to create. And in doing research and talking to the industry leaders in our general area and friends in healthcare, we sort of realized that home care wasn't broken. The home care system wasn't broken, but it just needed to be polished a little bit. And that's what we decided to do. And what does that mean? That means answering the phone as quickly as possible. Answering the phone all the time, all right? Working days, working nights, working weekends, working harder than our competitors. Saying yes to as much as we could in the beginning as we figured out what we were doing. And that's really how it is. When people call us, as we've learned and we're told, and it's definitely come to fruition, it's truth, is that people need you sort of in a crisis situation. It's often like your relationship with a plumber. You don't need a plumber 3 weeks from now. You don't need a plumber you need a plumber 30 seconds ago or 30 minutes ago. In a lot of cases in the home care world, mom's fallen, dad's fallen, grandma, grandpa, whatever, you've fallen. You're in the hospital for a couple of days. They want to discharge you. You don't want to go to rehab, or you want to go to rehab, but you want to go with somebody to hold your hand. I need help. Where do I go? And that's the service that we provide.
That's amazing. So how does Synergy, say it for me.
It's Synergy HomeCare Metro, New Jersey. That is our
Okay, Synergy. I don't know why I'm having a hard time on that
Synergy,
word,
right?
but
Which is,
anyway, how does Synergy
bringing in
define?
various aspects to
Yeah.
work together
Yes.
um, cohesively and in a like-minded, um, direction.
So is that the synergy effect?
That's what we're trying to make it.
What you talked about before, or what do you mean by that synergy
So
effect?
it's, if you or your listeners have ever had to deal with home care, there are a lot of players in the play. All right. There's the client. There's usually the client's children, because we're usually dealing with people who are elderly and dealing with their responsible loved ones. There
Yep.
is the healthcare community, the doctors, the nurses, the rehab people. There's us as the provider of the home care services, the person that comes into the house and provides the care. Everybody has an opinion, and all those opinions need to be heard at all times. But one person, especially the client, can't have the only opinion, right? And we've taught our clients and our community that, because sometimes mom and dad are not going to make the best decisions for them. I don't want anybody in my house. I can do it myself. I've done it for years, right? You're dealing with a very proud people that have grown up in the Depression era through wars and conflicts and all that stuff. And you find that they continue to think that they can do things on their own, and it just becomes not the right choice. And we have let everybody know that we will let you know if we think you're making a bad choice. You can continue to make the choice, but just let you know it's a bad choice and why. So,
right.
Yeah.
Yeah. I mean, my grandmother, she lived to 102.
Congrats.
And, but she ended up going to an assisted living. And at first she was in an area where, she could do whatever she wanted. And then we had to move her up to like a memory care. But, it was amazing, the care that they gave and needed. So, we need organizations like yours to be able to help us, because it's not an easy job. She lived with me for like maybe a year. And the same thing, it was too much chaos in my house because there's young kids, she's like, I don't like this. And then she didn't really like people coming in. So finding that right fit for the families and the elderly person is so important.
We turn to experts for guidance in areas that we don't know or we don't think we know enough. You had mentioned you were previously in the insurance business, right? People come to you. The insurance business is as confusing as any entity in the world. It's ever changing, right? Where am I now? Yeah. What do I need in the future? How do I balance the payments of health, long-term care, all that stuff, right? So,
absolutely. Making sure you're protecting
protecting what is important to you, even though you don't think it's important to you. So I mentioned the reason why I got into this business. My wife, who passed away, we had great insurance, great life insurance, right? It helped propel myself and my kids into a lifestyle and continue the lifestyle that we were leading, right? Without that,
without too much disruption,
I'm telling you, it would not have turned out the way it has, and it's turned out very nicely. Okay,
and that's a huge thing. A huge area where you don't know, so you have to be prepared.
Right. So in talking to those in the know, what the elderly stage of life is very expensive. It's very emotional, right? It can be very fragmented. It brings out, when dealing with mom and dad or grandma and grandpa and these big decisions in life, it brings out a lot of stuff that may have been buried for a long time between siblings, between families. And so what we are is, yes, we are a provider of home care services, but many of us are sort of practicing street social work. And I say that, with no respect, yet tremendous respect, no disrespect, tremendous respect for those social workers out there in the world, who are licensed and do this professionally. I don't do it. I've just sort of become an expert in my field through
And the empathy that you have for that's what helps you, and be that person that wants to give this, especially with your background.
We see it all the time. Every family is unique, and every family goes through the maturation process of, mom and dad fell. And just as you said, your mom lived with you or your grandmother lived with you for a while, right? And it's exhausting because it's the sandwich generation. It's, you're taking care of multiple entities in your life, and it's exhausting. And I always tell people, everybody gets into this caregiving mindset as this rich, juicy grape that has dew on it that you see in the wine or the grape ads and in the magazine. And it doesn't take long to go from that rich, juicy grape to the raisin or to the prune. You just get sucked down in the daily. And if you're dealing with loved ones who have cognitive issues, it's even more intense because you don't see the wound, you don't see the injury, you don't see the disease, right? But when they ask you the same question over and over and over again every day, it's just, not a lot of people can handle that.
No, just to be able to, just keep responding. Oh yeah. Yeah, it's tiring for that person too. And you love that person. So you want to do what you can, but it's hard. So being able to even just learn how to deal with that and, when it's happening, so you don't get frustrated.
Absolutely. And there's a lot of frustration, and we tell people we provide care for everyone in the household. So, the client is the client. We provide care, but our being there, we really encourage the spouse or the children to take advantage of our presence there and go do what makes you happy. Give yourself a chance to breathe. If it's for a walk, if it's for a book club, it's for a theater, it's going to the gym, play cards, go have a glass of wine with your friends or whatever takes you to that happy place. We strongly encourage that because you need a break. I guess the most, the easiest example I can give is when you're on an airplane and the oxygen mask instructions come down. What do they tell you to do? Put your mask on first, get yourself settled, then they take care of everybody else. And that's really something that needs to be understood and continually practiced.
Yeah, in life.
You can't take care of everybody unless you don't take care of yourself.
Yeah, and we forget that as individuals a lot of times, and so that's very important. So there's many home care providers out there, and in your view, what makes Synergy HomeCare different than others, and how do you balance providing compassionate care with flexibility families often need?
It all starts with caregiver respect. It all starts with the people that we hire who are actually going into the homes and doing the work that we are hired to do. Okay. I go in and I meet the family. I see the environment, the life way of the house. I meet some of the players that are involved. But at the end of the day, we're only as good as the people that represent us on the daily basis. That comes from the heart. And so respect is really one of the things that we've really started with from day one. So when I go in and I talk to people, I go over the various paperwork, scenarios, and try and level set expectations. And what I tell them, there's 5 things that make us different. It's full transparency, communication, honesty, respect, and the use of please and thank you. Definitely us to you, we ask you to us. I cannot send a caregiver in and force them to go take care of Mr. and Mrs. Smith. Okay, I can invite them to do so. And the clients can say, well, I like your caregiver, Jane, right? Or John, right? Or I don't like your caregiver, Jane or John, right? Conversely,
finding that fit, it can be difficult.
Jane and John cannot like you and say, you know what? I'm not going to go back and take care of the Smiths because they treated me with disrespect. And that's not right. So it's a matchmaking process. And what we really try and do, and the word that is sort of I've been using a lot lately, is let the relationship marinate. Is give it a chance to learn one another. Give somebody a chance to accept care. Give the caregiver a chance to learn about their client. and we hold their hand for as long as they need hand holding for. I always say my longest client was 11 years. My shortest client was 11 minutes, and both people got good care, the care that they wanted. The 11-minute client wanted to come home from a facility and pass away in their own home, and they did.
Right.
And the 11-year client wanted to live in her condo safely for as long as she could, and she lasted for 11 years.
Yeah, amazing. So, can you share us an example, a story, approach that really made a difference for a client or a family?
We had a client who we started working with who wanted 2 hours of care a day, 2 days a week. By the first day, the daughter realized that mom needs significantly more care, and we went to a live-in scenario where our caregiver moved into the apartment and took care of mom for 5 years. And it's not just one caregiver, but a number of different caregivers. And this woman went from leading a somewhat disheveled life a little bit to somebody who was well taken care of, engaged, came back from some of her issues to live a very fruitful life for most of that 5-year engagement until she passed. And you make a difference with detail. So, we've all had the opportunity to work with you get more results with a personal tutor, with a personal trainer, with that one-to-one. That's what we provide, right? We make sure that the meds are taken, that the person is clean, that the clothes are changed, that the meals are consumed, that doctor's appointments are adhered to. And that's how we make a difference. We've had a variety of clients over the years that have, really interesting stories, and you find out about them. Buyers for department stores that used to travel the world, rocket scientists, bankers, billionaires, people who fought in, the front lines of armed conflicts. And unfortunately for us, we only hear about them in their later years. Most of our clients are in their 80s and 90s or so. But you make a difference in those lives by listening and letting them age with dignity. And that's how we make a difference. I mean, a list of clients I could go through, some magical people.
That example you gave me reminded me of when my grandmother moved in with us. Now, the reason she moved in with us is she kept falling, and we were like, whatever, I couldn't figure it out. So we moved her, and I think it was because she wasn't eating. She wasn't eating properly. Her muscles were losing. She's having toast because it's easy to make.
Exactly.
And I think just feeding her the right food stopped her from falling down. She fell once.
I think people have to have a purpose, right? You have to have a reason to get out of bed in the morning, right? And we all have our bad days, and we all have our great days, right? But it's those days in between where I gotta, it's Monday, I gotta go back to the grind. And when somebody doesn't have that purpose, then they lose that verve. And the human body it's like an engine. You got to feed it. You got to feed it from a fuel standpoint. And that fuel consists of food. It consists of adherence to medicines and health. The brain needs to be fed. The socialization aspects of our life is probably the most important. If you got friends, you got a lot more than just good health. You've got a reason. You've got that passion, purpose.
Yep. Absolutely.
And getting back to your grandmother's example, a little protein here, 3 squares a day, they say, right? And taking the medication, getting up and exercising, and not sitting in front of on the couch all day, watching bad reruns of old TV shows, right?
Say, hey, come on. You have that extra person that's helping you along the way.
And, and in more recent times, a lot of people just sit and watch the news. Okay. And that is just exhausting on every level in these times. And you think the world's coming to an end, and it's not. And so going out and being
Well, we can't live like that
You can't live
anyway.
like that anyway. And being engaged is engaged in something is a wonderful, wonderful aging existence. So that's
My grandmother, she actually worked at a hospital until she was 99 and a half in the emergency room. And she had worked there since 1980, something like that.
you know what? It
Ridiculous.
keeps her going. I had a
And
great.
she knew every Monday and Thursday because those were the days. So she always knew Monday and Thursdays. There was
And she's
no,
looking forward to it. Over the weekend, she's looking
yeah,
for Monday, Tuesday, Wednesday. Tuesday, she's resting up from Monday. Wednesday, she's looking forward to Thursday. Friday,
yep.
she's resting up. Yep.
So what type of services do you guys provide? Or there's anything that we haven't talked about, and is it tailored to meet different
So in the
needs?
non-medical home care world, what we provide is people who will come into your place of residence and help you from the minute you get up until the minute you go to sleep. So getting out of bed, getting dressed, the toileting aspects, the meal prep, the med reminders, the cleanup. So we break our service packages down, as most people do, to companion care, homemaker care, and personal care.
Okay.
Personal care is touching the body, sort of making you clean and available to engage in the day. The homemaker aspect is keeping your living space clean and tidy and well suited for a living. And then the companion care service is sort of the friendship part of it, is engaging in conversation, is like, hey, let's go to the park, let's go for a walk, let's go meet your friends. We care for people not only in their homes, but in a lot of facilities as well. Right? In the assisted livings, they don't really call them nursing homes anymore. It's more skilled living centers. And in independent,
and there's people who came in. We had people that came in for my grandmother that were not from the place where she lived, but for extra care.
You want that one-on-one care. And today, there is a tremendous amount of money out there. There are a tremendous amount of people who have the means to live their life on their terms. Not everybody, and I'm not naive in that sense at all, but we cater to that part of the population that can afford what we do. And, when you're spending a lot of money in a facility, you want that care, you want that love, and you don't want to, ring the bell and wait 25 minutes when you have to go to the bathroom. They're like, hey, I'm going to hire a personal aide on top of that. So when I got to go to the bathroom, they're right there to take me, and I don't have an accident and sit there waiting.
It was funny when my grandma was there. She would be like, I got to go. Bingo's starting. I'm not missing any events here because I'm paying so much money to be here. I got to go. And, and she was so funny. She's like, got to go. There's an event going on or a movie showing.
That's what kept her going. That's the mindset that keeps her going.
Yeah, absolutely.
And, nowadays, as we, as the human species, is living a lot longer via pharmacological advances, technology, lack of smoking, lifestyle choices, understanding of food for better or for worse, whatever. We're just living longer. And
it's going to be even longer now.
Now. Is that a good thing? Who am I to answer, right? It's all about quality of life. It is not about the number. It is about the journey. And, there's a lot of cognitive issues out there. One of the scary things is, when you have Alzheimer's or other cognitive issues, you start to realize that you forget stuff. People around you realize that there's something going on. And then you tend to withdraw as the memory challenges and the engagement challenges become harder. And it's almost like a self-fulfilling negative prophecy. I'm withdrawing so I don't have to do, but by interact, because I can't remember my friend's name who I have been friends with for 50 years. Right. And it leads to isolation, which leads to poor habits, which leads to isolation, which leads to poor habits. It's
depression,
right? Depression and all that stuff. So we really try and help people out of that. And that's a lot of what we do. A lot of what our caregivers do.
It's so important. How do you ensure caregivers are prepared and trained to meet the variety of all these,
So I am in the state of New Jersey, and we are what they call licensed state. So everybody who works for me is not only a licensed home health aide, certified by the state of New Jersey, having gone through schooling, passing skills tests, passing ongoing skills education quizzes and things like that, always training. And they are, like I said, they are my employees overseen by a nurse. So we continue to actively hire people who we feel represent us well. We have a lot of applicants that we don't hire because we just don't feel they meet our criteria. Most of our staff are immigrants, women and men in northern New Jersey, Caribbean, North African descent. So language is an issue, language differences, cultural differences. And we really try and bridge that. And we try, from a business standpoint, we try and make good hires and not bad hires. I'd rather not hire somebody than take a flyer on somebody that I'm suspect on and have it go sideways. That doesn't really bode well for anybody.
I mean, it's too important. It's too important when you're dealing with trying to help people in their care. It makes it even more, as a you got to make sure that you're making that right choice, or at least try to make that right choice the first time. And you're not going to do it every time, but
you hear stories in the news cycle about caregivers that are taking advantage of their clients, and there's always the bad apple in the bushel and stuff like that.
I mean,
I would say that's very, very minimal, especially when you hire through an agency, because there is oversight and hindsight and background checks and reference checks. And we do a very good job of making sure that the people that we hire are of the highest quality.
So you talked about communication with, everyone involved. Do you guys use technology to do that, or is it?
We do. We've got the whole online presence. We've got a Teams account. We've got, everybody's got a text. We text back and forth. We talk to the responsible parties, usually the children, and get them involved. We're always available.
I just didn't know if there was anything like that you had set up automatic where it's
we're
nothing like that yet.
We're hesitant to do that because we feel the difference is the personal connection, right?
Oh, absolutely.
I want to talk to a human being. I don't want to just talk to an AI chat bot, right?
No, I don't. I wouldn't think that at all, that you'd want to do that for sure in this type of.
Yeah. But we're aware that we always tell our caregivers, assume there's a camera in the home. Okay. So whatever you say, do, there's a chance it's going to be recorded. We provide technology. We provide baby monitors to people. So if you've got somebody awake, sleeping at night and our aide is there and they need help, we usually use a baby monitor as a communication tool. We use an automated system for clocking in and clocking out, mobile apps, things like that. But we haven't got into the robotics. We haven't got into the electronic dog.
I can't. I can't see that anyway.
We have clients that do. We have a client.
Maybe for like back end administration things, and not so much for.
Yeah. And we really try and cater our business to the individual life ways of the families that we service. So we deal with a lot of long-term care insurance policies, policyholders, and issues that brings up. So we guide people through that process. And we deal with the Veterans Administration. So we help people deal with that. We deal with employee assistance programs. So if you've got a family member that it works for a big company, there's some opportunities to save some money in providing care for a loved one. We really try and present the width and breadth of opportunities for good care, and affordability. Budget always matters. And our paperwork even says it's a service agreement. It's not a contract. So they can cancel at any time with one phone call. Yeah. We get it. Yeah.
So choosing care for loved one, it's a huge decision. What advice do you have for families who are exploring home care options for the first time?
So the number one bit of advice that I will give people is have a discussion with everybody, including all the players. So mom, if dad's around, and vice versa, or grandma, the siblings, know what their wishes are. know what their finances are, know what their everything is involved, and have that discussion. Because if you plan it, it makes it much easier to execute on that. And things will change. We all
Mm-hmm.
have had that promise that I will never put you in the home, right? I'm air quoting for those listening, in the home, right? Sometimes the home is absolutely
It's
the
better.
best place for everybody. The client,
Right.
mom and dad, grandma, grandpa, they're getting care, right? You and Kristin, you lived it with your story. It's exhausting, and it may be a
Yeah.
little bit more financially stressful, but emotionally, you're not wrecking your family.
Yeah.
But it's really
And it was
having
hard.
that
It was hard on
discussion.
my children, and it was hard on her. It was hard on the children, and it was hard on
We
her.
take care of a woman. We take care of one family now, 4 generations in the house. The grandmother,
Well,
the daughter, the daughter's daughter, and the great granddaughter, right? So grandma, daughter, granddaughter, great granddaughter, right? It's tremendously exhausting. People are coming,
yeah.
going, little kids, working moms,
Oh yeah.
retirees.
Yeah. It's
They
chaos.
make it work because it's been working
Yeah.
now for several months in a nice environment, but it's hard.
Yeah.
It's hard, and it can change like that. We talked about falls, right? People
Yeah.
fall, and they're going to fall in their home. They're going to fall in a facility. They fall in the airport. They fall at the mall, the grocery store. People fall. You try and avoid that as much as possible. But I get clients who call me, well, we really want mom to stop falling. Well, unless we're literally holding on to her, right? I can prevent it. If somebody who weighs 120 pounds, which is not a lot, is going down, there's nobody stopping her. Right? So, those are some of the
No.
things that we try.
And it's going to be quick. And it's going to be
It's going to be
quick.
quick.
So you have to you have to have reflexes, cat-like reflexes.
I have had numerous dozens of clients over the years who've, grandma's going down, grandpa tries to stop the fall, grandma and grandpa go down, grandma and grandpa are now my clients.
Yeah, well, I'm hoping that doesn't happen to my parents because I can exactly see that
Absolutely.
happening. The two of them trying to help each other, and they're both screwed, basically.
And what we're finding is that people are indeed living longer in their homes because they don't want to go to the facility. They have the value in their house.
Mm-hmm. All the reminders,
all the mementos. They've been there for 50 years. So you ask, what's the single most important thing? I say having that discussion. If I sit down and talk to you, I said, what's the number one thing is that I want to age and die in my house. Okay, then let's work towards that. If I want to age for as long as I can and then go to the facility, okay, let's work towards that. There is no right or wrong. It's really what's the choice is for those individuals.
Yeah, and if you try it and if it doesn't work, then you make the change.
Exactly. And if there's one thing that's constant in life, it is change.
That is for sure. So what's important questions families should ask when they're evaluating a home care provider?
So you want to interview an agency. You want to make sure that people are available 24/7, 365. There is no reason that people are not. Okay. Everybody in society has a cell phone. Everybody, and that cell phone can be turned on and, at any time. You want to make sure that you've got redundancy and, if my caregiver is there and she calls out sick, do I have another caregiver or am I on my own for 2 days until you find somebody else? What am I committing to by committing to you, right? Can I make a change? Is there an understanding? Those are really the keys. As the environment changes, and it will change, will you be able to adapt? That's
well, and that's what you said. You don't have a contract; you have a service agreement.
Correct.
And that makes a big difference because in business, I've signed contracts and then I didn't look at the cancellation. And I always tell people who are in business, that's the one thing you look at on every contract is when you can get out of it.
Right.
Because I've made that mistake and I was paying thousands of dollars a month on something I didn't like for 5
You know,
years. I signed the
we
contract.
used to, when we first started out as a new business, we used to take a deposit from everybody. If you were going to do a 2-week care plan, we would do a deposit of that 2-week care plan. A week care plan, we'd do a 2-week deposit. We take a credit card as well. We put some money off of it. We don't do that anymore because we've built up, some heft and a trust in the community. Listen, I know where you live because I've been in your home, right? And we don't. We take a credit card imprint and we just, we leave it in the file, and we give you payment options over time, and you can pause services, you can expand services, you can adjust services. We work with our clients because our clients' needs change all the time,
So do you have any last minute things that you'd like to tell us about the organization or anything else?
So I am one of the owners. I am the outside person of the ownership group. My partner David does the inside, and I'm only as good as the team that I have. And I have a wonderful team. And I think that anybody who is hiring an agency should dive deep into the agency's depth and also ask questions and continue to ask questions. But again, going back to the most important thing is have a plan, have a discussion. Do not wait till the last minute, right? If you see mom and dad are aging, have that discussion. If mom falls, excuse me, and goes into the hospital, whatever, get her situated in the hospital and then call and find an agency or talk to your team and say, all right, let's plan this out, because I can react quickly. I say that, on behalf of all agencies, I can react quickly. It's hard for me to react instantly because my assets are human people, are human capital.
Right.
So,
absolutely. Yeah. Well, Casey, thank you so much for sharing your insights and for giving us a closer look at Synergy HomeCare and how it's helping families live with dignity, independence, and comfort. And for our listeners, if you'd like to learn more, you can visit at synergyhomecare.com to explore local services and resources. This concludes another episode of Mic Up, the next chapter, moving past disconnected systems. I'm your host, Kristin Guglielmo. Thank you for joining us today. Thank you so much, Casey.
Kristin, thank you.